All right, if everyone's ready, we'll go ahead and get started. Hello, good afternoon. Thank you for being here. My name is Abigail Spanberger, and I am proud to represent Virginia's 7th District in Congress. Thank you for joining us. I want to first thank Sentara Health for hosting us and for being a part of this community's work to treat addiction and support recovery. I also want to thank Chief Newsham from the Prince William County Police Department, Supervisor Andrea Bailey, who will both be providing and have provided to our office their voices on this critical issue of community safety. We're here today because we are facing a crisis in our communities and across our Commonwealth and across our country. Since the COVID-19 pandemic, we have seen a surge in rates of substance use disorder, often driven by increases in stress, social isolation, and grief. Most shocking, though, is that Americans continue to die from overdoses at record high rates, and fentanyl is the primary culprit. We've seen firsthand in the Commonwealth in 2021, fentanyl caused or contributed to more than 75% of overdose deaths in Virginia. And alarmingly, those numbers continue to rise to the point where drug overdoses are now the leading cause of unnatural death in Virginia. I come to this issue from a few different perspectives, one of them being, as my background as a former federal law enforcement officer and a former CIA case officer. As someone who worked narcotics cases and tracked cartels, I am concerned about the threats posed by fentanyl. And I'm concerned about its potency at extremely small levels. I'm concerned about the difficulty in its detection, and I'm concerned about the lives it's taking and the lives it's destroying here across our Commonwealth. Recently, we have seen horrific reports about a sharp increase in the trafficking of fentanyl mixed with veterinary tranquilizers, a street drug known as tranq. And I've heard directly from law enforcement departments across our area, including here in Prince William, who have voiced their concerns about these trends. I've heard departments make the case for equipment that can help them more quickly identify fentanyl and fentanyl-related substances. And last month, I introduced the Providing Officers with Electronic Resources Act, or the POWER Act. I stood with both Democrats and Republicans to introduce this bill, including Senator Sherrod Brown, a Democrat from Ohio, Senator Tom Cotton, a Republican from Arkansas. And while Democrats and Republicans on Capitol Hill do seem to disagree on many things, maybe to put it lightly, it is clear that both parties agree on the need to give law enforcement the tools that they need to fight fentanyl in our communities, and we need to just get it done. Fentanyl has made it to every state in our country, and that means that local and state police should have the same equipment that federal law enforcement already uses to detect this deadly drug. The POWER Act would create a new grant program, one that would help local police departments, like Prince William County Police Department or any of the localities that I represent, or any across Virginia, secure high-tech screening devices to detect fentanyl. Without these devices, suspected drugs are often sent to labs for testing, and in some cases, this can take months. We know that these devices work. Federal law enforcement is already using these devices at our borders and our ports of entry. They can quickly analyze potentially harmful substances, even through packaging. By making sure that law enforcement officers here in Virginia have these devices, we can quickly identify when fentanyl enters an area. We can warn our neighbors and build a response plan to save lives, and we can protect the men and women of law enforcement who keep our communities safe every day. I'm proud that our legislation already has the support of a wide range of law enforcement organizations, including the National Fraternal Order of Police, and I want to thank the Prince William County Police Department for their support of this bipartisan bill. I'm also proud that community healthcare providers, including Sentara, understand the urgent need for stronger pushes to detect and stop fentanyl from making it to Virginia streets. Thank you for joining this effort. I'm confident that our bill, with the support in both chambers of Congress, has a path to the president's desk and can be signed into law. And frankly, the sooner the better. This bill alone will not be the silver bullet in our fight against fentanyl, but it can be part of a strategy that recognizes the complexity of the challenges ahead. And today, I think we are all in agreement that our response to substance use disorder, overdoses, and drug trafficking here in Virginia needs to be multi-pronged. Police departments and first responders are on the front line of this crisis, as all. In a few minutes, we'll be sitting down with many of these Virginians who work to address the opioid epidemic and the substance use disorder crisis. These men and women are there for our neighbors. They are there in the darkest moment for many Virginians, and then in the darkest moments that many Virginians will ever experience. They provide hope, and we need to prioritize an approach that gives law enforcement the tools they need, while also making sure that our treatment and recovery professionals have the support that they need and deserve. Virginians like those here today are working tirelessly to help our neighbors, and they're providing more pathways to recovery for Virginians who are in distress. And public servants, like our police officers, are committed to blocking these deadly substances from taking more lives. The fight against fentanyl will be a long one, but we have the knowledge, the skills, and the commitment here in Virginia to win. And with that, I'd like to turn it over to Chief Newsham from the Prince William County Police Department. In my role, I've had the privilege of getting to know the chief, and I'm grateful that he can share his perspective on the threat of fentanyl in this community, as well as how we can combat it together. Chief.
Well, good afternoon. I am Pete Newsham. I'm the chief of the Prince William County Police Department, and I want to thank Representative Spanberger and the other members, bipartisan members of Congress who are supporting this legislation. As the representative said, this is bipartisan legislation, which means oftentimes this is common sense legislation that needs to be passed to help local law enforcement. I also want to thank Supervisor Bailey for being here today to show her support on the Prince William County side for this important initiative, the POWER Act. As the representative said, Prince William County, like other jurisdictions in the Commonwealth of Virginia and across the country, are facing an increasing number of fentanyl overdoses and also fentanyl-related deaths. It has taken over as the #1 killer in overdoses in the Commonwealth of Virginia and in Prince William County. I also want to talk with you two scenarios that our local law enforcement face on an increasingly significant number of times. The first scenario is a police officer will get a call for service to the home, usually from a beloved family member, of one of their loved one who's in the home and they're unconscious. When the police officer arrives on the scene, all they have on the scene is a person who is unconscious, and then oftentimes that person ends up dying. That person, we come to find out through investigation, oftentimes had a substance use disorder. Those of you, and I know everyone, if not everyone in the room, knows somebody with a substance use disorder. This is a disease. It can take over a life, and it's very sad. But when somebody has that disorder, of course they're going to use drugs, but the sad part is when they get a hold of fentanyl, it can be fatal. They will never have an opportunity to recover from that disease. A second scenario, and this is even probably equally, if not more terrifying, a police officer gets a call to the home of a family member who has tried drugs for the first time. That person is unconscious on the ground. They had no idea that that drug was laced with fentanyl, and that person has unnecessarily lost their lives. So when we talk about this drug, the words that come to mind to me are sinister, ruthless, and vicious. And it's senseless that we're losing people in the Commonwealth because of this senseless and vicious and sinister drug. What this tool will do for local law enforcement is we'll be able to quickly identify on the scene whether or not fentanyl is used in this case. Go back to the first scenario where we just have somebody who's unconscious. They pass away. They have to go to the medical office, medical examiner's office, and tests need to be run. That takes a significant period of time before we'll ever know what the cause of death was. And certainly it'll take a long time before that we know it's fentanyl. If we can know that it's fentanyl when we're on the scene, let's say, for example, a law enforcement officer is exposed, we can get them the proper treatment. It also gives us the ability on the investigative side to immediately start our criminal investigation into who is selling those drugs, who is selling those drugs in their community. And thirdly, and just as importantly, it gives us the ability to quickly notify our community that fentanyl has creeped into our community. Because what happens with the drug dealers is the drug dealers will do it in certain regions. And it gives us the ability to alert our community and to avoid our folks who have substance use disorders from they'll be thinking about it. Okay, there's fentanyl out there. Maybe they'll be a little bit more careful. Certainly for our people who are using drugs for the first time, hopefully it will open their eyes and say, hey, this could be the time that takes my life because there's fentanyl in my community. So this is a critical step forward for law enforcement. It'll be a critical step forward for Prince William County. I want to thank Representative Spanberger for being the lead on this. I want to thank your colleagues in Congress. And I hope that the rest of our country will see that this is common sense legislation and that it'll pass very, very quickly. So thank you all very much.
Thank you, Chief Newsham. I now want to introduce Supervisor Andrea Bailey, who represents the Potomac District on the Prince William County Board of Supervisors. Here in Prince William, Supervisor Bailey has worked tirelessly on issues of mental health and substance use disorder, and she's made these challenges a priority for her in her service to the community. So I'd like to invite her to share her perspective.
Good afternoon. It gives me great pleasure to stand with Congressman Spanberger on this initiative. It will pass. It will pass. It's an initiative that's necessary. Most of you know I am the champion in Prince William County for mental health. I grew up in an environment where I believe I was trained to become your champion. My first cousins, and Chief Newsham knows this, were the drug lords in St. Louis, Missouri. My dad was a DEA agent. Think of the dichotomy of that. My mother-in-law suffered from bipolar disease. My mom currently suffers from dementia. And I have a brilliant son who is absolutely handsome, but he suffers from ADHD, functions every day. But what I learned as I was being groomed to be your champion is that mental health has been swept under the rug for a very long time. It comes in different phases. I grew up in the crack cocaine era. It's similar to what we're experiencing now. And a lot of it comes from mental health disorders. And so I stand before you, partnering with your police chief. He and I have had numerous conversations about how do we help our children, how do we help our adults, how do we help our seniors, how do we heal the mental health land, the minds in our community? This can and is on the route to be an epidemic. So I applaud the Congresswoman for seeing that in advance to give us the tools and the initiative to heal the land. And so thank you for this opportunity. I won't give you statistics, she's already done that. I won't tell you about how crucial this is. Chief Newsham has already done that. But what I will say is thank you for being in the room. Thank you for Centera understanding the importance of being in the room. And thank you for your investment in our children and in young adults and making sure that fentanyl is wiped out and an increased level of quality of life is garnered in. Thank you.
Thank you, Supervisor Bailey. Now I would like to invite Nedra Moncrief-Craig to share her comments. Ms. Moncrief-Craig serves as the System Director for Behavioral Health Services for Centera Health, and I'll turn it over to her to share her comments about this crisis, what she's seeing here, and how we can work to combat it together.
Hi, good afternoon. Thank you, Representative Spanberger, and thank you, everybody, for coming out today. This is such a critical time in our country, and especially in Virginia. According to CDC, the number of people in the state of Virginia are dying at record numbers, especially in Northern Virginia. It's higher than anywhere for fentanyl and opiate overdose. So at Centera, we have seen our numbers increase in all our EDs. Centera has 17 EDs throughout Virginia and Northeast North Carolina. We have decided that it is critical for us to focus on making sure that we provide treatment in the EDs to individuals coming in there with opiate use disorder and making sure that we have the right medication on hand so we can prevent some of the overdoses. We are training all our primary care doctors, our ED doctors, nurses, to recognize when individuals come into the ED. We are building relationships in the community with Supervisor Bailey and her mental health task force, along with the CSBs, Youth for Tomorrow. How do we come together as a community, convene, work together, because it takes all of us to make sure that we're taking care of the people in our great Commonwealth. So at Centerra, we're your partner. Reach out to us. We're going to keep educating our staff. We're going to keep providing services. We're going to keep working alongside of everyone to make sure that we provide the right treatment at the right place and the right time. Thank you.
Before we move on and proceed with our roundtable, we're going to open it up to any press questions based on the initial introductions that you've heard here today. Yes.
Hi, Mauricio Casillas with NBC4 Washington. Appreciate you taking the time to do this. Representative, what comes next? What hurdles do you still have to clear in making sure that this POWER Act does go through?
So this legislation is consistent with legislation that I've worked on, combating fentanyl coming through ports of entry along the southern border. Bipartisan legislation that I led in that space was signed into law at the end of last year. So we know what it takes, and to answer your question, it takes members of Congress across the country signing on as co-sponsors, and it takes us in my office and my counterparts on the Senate side continuing to push for this to be a priority, and either to move as a standalone piece of legislation or to get pulled into a larger piece of legislation that might be addressing similar or related issues. So that's the work that we're endeavoring to do, and frankly, the importance of raising this issue here in Prince William, regionally in Virginia, across the Commonwealth, is an important step of highlighting both the challenges that we know we're facing on the ground, but how there are tools that aren't going to solve the problem in a day, but are tools that our law enforcement officers need to be able to alert a community to threats that may exist and really respond quickly and effectively when they are called out in those scenarios that the chief gave.
Is there any timeline, ideally, when you would like to see kind of the tangible effects of this?
Yesterday. So we had some hurdles we were getting through on Capitol Hill this week with avoiding catastrophic default. And so now we're going to be rocking and rolling, getting co-sponsors signed on to the bill. My personal goal is by the end of the year so that this federal funding would be available into next year. That some might say that's ambitious, but I think our communities can't wait. So that's my goal, and I'll be working hard to try and achieve that.
Do you have a question for the chief?
Yes.
And anyone else, feel free to chime in. Take a lot of questions. But chief, I wanted to ask you, how would that work if this does pass through and you're able to have the screening techniques and equipment that you need? How would that, you mentioned it briefly, but just change the way that your officers approach these scenes, which you mentioned are becoming far too common?
Yeah, so one of the things that we lack the ability to do right now is to immediately identify the substance in these instances. This tool will allow us to do that. And the three areas where I told you that this would be critically important, if you have a law enforcement officer who's exposed, you got to take them to the emergency room. And we have doctors in the room. It's going to be a lot easier to know what they've been exposed to up front to be able to treat that. Secondly, we'll be able to start the criminal investigative process for fentanyl in particular, because there are, in the state of the Commonwealth of Virginia, there's really good penalties about distributing fentanyl, particularly if it causes somebody to lose their life. And so we can start that investigation right away, knowing that it's fentanyl. And then the last thing, and like I said, this is just as important, alerting our community. There's two types of users that I see in my career. You have the substance use disorders, that chronic users because they have this disease, which is this addiction, which is causing them to frequently use, and then you have the first-time users. And so I can say this, most of these folks, if not all of them, are very young people, and they're certainly younger than I am. And so you're unnecessarily losing these lives in the state. And again, for the representative to look at this as an important issue, to be the person who's out front trying to fix this, all I common sense. That sounds a little condescending.
I'll take it, it's true.
But not, a lot of times our community doesn't see our Congress acting in a common sense way. But this one, I really want to say, this is common sense. It's going to help local law enforcement.
How long does it take now, Chief, if there's a suspected overdose?
It's months before we know. And so the other part of this too is all the data that we have on overdoses now is lagging because we don't get the results for several months. So we can give you a number today of how many fentanyl overdose fatalities we've had, but it's not accurate. It's going to change as those results come in.
All right, I'd like to welcome Alice Tang, Chief Medical Officer, up to do our introduction.